Here is your ***, properly formatted, fully punctuated text ***, with ***, no content or spelling changed ***, exactly as requested. 1 in every 2 men over the age of 40 experiences some form of sexual performance challenge, whether it is difficulty maintaining firmness, trouble sustaining arousal, or feeling like their body does not respond the way it once did. Yet most men carry these concerns alone. They do not talk about it with their doctor. They do not bring it up with a partner. And in that silence, frustration often builds. Not because something is wrong with them, but because they do not have the information they deserve. But here is the truth. Your body is not failing. It is communicating. The changes you notice in firmness, sensitivity, recovery time, or endurance are signals. They are reflections of circulation, hormones, nerve function, stress levels, and the health of the tissues that support an erection. When you understand those signals, you stop feeling confused and start feeling in control again. Today, we are going to talk about something simple but surprisingly powerful, a small nightly ritual rooted in physiology, not gimmicks. Something supported by what we know from research on skin health, microvascular function, and arousal mechanics. It is the use of a clinically safe, high-quality oil before masturbation to support better glide, better stimulation patterns, and less friction-related stress on the penile tissue. And these details matter far more than most men realize. Think of it this way: an erection is a vascular event. It depends on blood flow moving freely through arteries that become more delicate with age. It depends on the endothelium, the ultra-thin lining inside those vessels, remaining healthy and responsive. It depends on your pelvic floor relaxing rather than tensing too soon. It depends on your nervous system staying in the right balance between relaxation and arousal. When any piece of that system becomes stressed or irritated, performance declines. Lubrication may seem like a minor detail, but in urology, we know it plays a meaningful role. The Mayo Clinic, the National Institutes of Health, and multiple dermatology studies highlight the importance of reducing friction on delicate tissues. Too much friction, especially in men over 50, can temporarily impair sensitivity, irritate the skin barrier, and even increase the sympathetic response that pulls blood away from the penis. That means firmness fades faster. By contrast, using a simple, safe oil, such as a medical-grade mineral oil-based lubricant, a refined coconut oil, or a vitamin E-rich topical, can reduce unnecessary friction, protect the epidermal barrier, maintain gland sensitivity, and support a more consistent erectile response. None of this is magic. It is anatomy, nerve physiology, and tissue care. In this session, I will walk you through the research, explain which oils are clinically supported, how to use them safely, what benefits are realistic, and why this matters even more for men after 60. We will separate myths from facts, outline practical steps, and help you understand how a small change in your routine can support healthier, more reliable performance. If you have ever felt frustrated, uncertain, or overwhelmed by mixed advice online, consider this your space to breathe. Your body is capable, your physiology is adaptable, and with the right information, you can support it in ways that feel natural, grounded, and empowering. When I talk with men in their 40s, 50s, 60s, and beyond, one of the most common themes I hear is this: things feel different. The skin feels more sensitive sometimes and less sensitive at other times. Erections feel reliable on some days and unpredictable on others. And for many men, masturbation or partnered stimulation that once felt effortless begins to feel slightly more abrasive, more effortful, or less naturally smooth. It is subtle, but men feel it, and it often creates a quiet worry that something deeper is wrong. Here is what the research shows. As men age, there are natural changes in the structure and function of the penile skin and the underlying vascular network. Studies published through the National Institutes of Health highlight that the epidermis becomes thinner over time. Collagen density gradually decreases, and the tiny nerve endings that govern fine touch become slightly less responsive. At the same time, endothelial cells inside the arteries that supply blood to the penis become more vulnerable to stress. These changes do not doom sexual function, but they do mean the tissue becomes less tolerant of friction than it once was. Let us break this down like I would with a patient. Imagine your pen, I'll skin as a thin protective shield. When you are in your 20s or 30s, that shield is thick, pliable, and resilient. It can tolerate fast, dry stimulation without much consequence. But as you reach your 40s and 50s, that shield becomes more like delicate parchment, still strong, still entirely functional, but needing a little more care. When friction increases, the tissue warms, micro tears can form, and the brain interprets that as irritation rather than pleasure. Irritation dampens arousal, and as arousal drops, firmness follows. This is something I see often in clinical practice. Men describe losing erection strength partway through stimulation, and they assume it is a hormonal problem or early erectile dysfunction. But sometimes it is simply friction, related endothelial stress. When the surface of the penis experiences too much drag, the body activates the sympathetic response. That is the same stress response that pulls blood flow away from the genitals when you are anxious. You can imagine what happens next. Firmness fades, sensitivity drops, and the experience becomes more about trying to maintain an erection than enjoying it. Now, here is the empowering part. This is not a major pathology. It is simply a signal that the tissue needs support. And lubrication is one of the simplest, most overlooked tools for providing that support. Research from dermatology and urology journals consistently shows that reducing friction preserves epidermal integrity, protects the nerve endings responsible for arousal, and lowers the risk of irritation-related loss of sensitivity. It also supports healthier hemodynamics, meaning the blood can flow more freely and stay within the erectile bodies longer. If this information is helping clarify things, give this video a thumbs up and keep learning with us. Your understanding of your own body is one of the greatest tools you have for protecting your long-term sexual health. Before we move on, here is one practical tip you can start using immediately. If you ever feel the skin becoming warm, tight, or slightly uncomfortable during stimulation, pause and check in with yourself. That is your body telling you that the tissue is being stressed. A simple application of lubrication in that moment can restore smoothness, reduce microtrauma, and help maintain that relaxed physiological state that supports firmness. When we look closely at the research on skin health, lubrication, and delicate tissues, a consistent pattern emerges. The oils that perform best are the ones that protect the epidermal barrier without clogging, irritating, or disrupting the natural balance of the skin. This is true in dermatology, in wound care literature, and in urology, where we apply similar principles to penile tissue. Here is what the evidence shows: medical-grade mineral oil-based lubricants and refined plant-derived oils such as properly processed coconut oil form a gentle, stable layer over the skin. That layer reduces water loss, prevents micro tears, and distributes friction evenly. The skin remains hydrated, the nerve endings remain protected, and the tissue stays supple rather than stressed. Research published through the National Institutes of Health has repeatedly demonstrated that mineral oil is highly inert. That means it does not react with proteins in the skin, it rarely causes allergic responses, and it does not alter the microbiome in ways that would lead to irritation. Let us break this down like I would with a patient. Think of the epidermis as a thin wall made of tiny interlocking bricks. Those bricks are your skin cells. Between them is a mortar made up of lipids. That mortar keeps the structure sealed and strong. As we age, the mortar becomes more fragile. The lipids thin out, the seal weakens, and the bricks can separate more easily under pressure. When that happens during stimulation, the tissue becomes drier, more reactive, and more prone to losing sensitivity. A refined oil works by reinforcing that mortar. It fills in the gaps, strengthens the seal, and allows the skin to move smoothly without tearing. It does not fight the natural physiology. It supports it. That is why pediatric medicine, burn care, and sensitives, skin research all point to mineral oil as one of the safest and most predictable choices. Coconut oil, when refined and free of proteins that can cause irritation, performs similarly. It creates a smooth glide, minimizes drag, and stabilizes moisture levels. This is especially important for men over the age of 50, where the combination of androgen shift, stress, and natural skin thinning creates a delicate balance between pleasure and overstimulation. Now, here is something many men do not realize. When the penile skin becomes irritated even slightly, it triggers a subtle sympathetic response. The sympathetic response is the part of the nervous system that prepares you for action. It tightens the pelvic floor, redirects blood away from the erectile tissues, and reduces the parasympathetic state that allows an erection to stay full and stable. This is why lubrication can make such a noticeable difference. It does not create erections on its own. It simply prevents avoidable irritation that would otherwise cause firmness to drop prematurely. So, what does this mean for your routine? It means that choosing a safe, inert oil can help preserve the natural sensitivity of the glands. It can help maintain comfort, prolong arousal, and support the physiological conditions that contribute to erection longevity. If this resonates with you or offers a bit of clarity, consider sharing your experience in the comments. Open conversation is how we shift the culture from silence to understanding. Before we move on, here is one actionable step. If you decide to explore refined coconut oil or medical grade mineral oil, start with a very small amount first. Apply it at the base of the shaft, not the entire penis, and observe how your skin responds over the next 24 hours. This is a simple, practical way to make sure the product is a good match for your unique skin chemistry. One of the most overlooked contributors to erectile function, especially in men over the age of 50, is the pelvic floor. Most men think of erections purely as a blood flow issue. And while blood flow is certainly fundamental, the pelvic floor muscles play a quiet but powerful role in either supporting or undermining firmness. The research is clear. When these muscles are overly tight, reactive, or stressed, they compress blood vessels, shorten the duration of firmness, and shift the body into a pattern of performance anxiety without the man even realizing it. Let us break this down like I would in the clinic. The pelvic floor is a hammock of muscles that sits beneath your bladder, your prostate, and the base of your penis. When these muscles are relaxed, blood can enter the erectile bodies freely, the penis fills, the shaft expands, and firmness becomes more stable. But when the pelvic floor is tight, especially around the bulbus spongiosum and ischiocavernosus muscles, it creates resistance. Blood enters, but the tension squeezes the roots of the erectile bodies, and the erection cannot fully stabilize. Many men describe this as an erection that rises quickly, feels strong initially, then drops off without warning. Here is where lubrication becomes relevant. Research in urology and sexual medicine has shown that friction increases sympathetic activation. Sympathetic activation is the body's stress response. It tightens the pelvic floor, accelerates the heart rate, and redirects blood away from the genitals. This response is essential when you are in danger, but not useful when you are trying to maintain an erection. When friction is high, the brain interprets the sensation as mild irritation. Even if you do not consciously feel stressed, the body begins tightening the pelvic floor as a reflexive form of protection. The result is reduced blood flow, shorter endurance, and a sense that your erection is fading faster than it should. This is something I hear frequently from men in their 40s and 50s. They say things like, "I feel fine at the start, but I lose firmness halfway through." Or, "I suddenly get tight below the base and then everything drops." Often, they are surprised to learn that this tightness is not psychological. It is mechanical, driven by pelvic muscle overactivity triggered by unnecessary friction. A clinically safe oil helps prevent that chain reaction. When the tissue glides smoothly, the pelvic floor remains relaxed. The parasympathetic nervous system, which is responsible for sexual arousal, stays dominant. Blood flow remains stable. Endurance improves, and the entire experience becomes less about control and more about sensation. Here is a helpful way to visualize this. Imagine the difference between running your hand across dry pavement versus across a polished wooden surface. On pavement, every movement creates resistance. Your hand tenses to protect itself. On a smooth wooden surface, your hand relaxes because it feels supported. Your pelvic floor functions the same way. Smooth glide equals relaxation. Excess friction equals protective tension. If this information is helping you connect the dots, consider giving the video a thumbs up. It helps more men find accurate, shame-free information. Here is one practical habit you can adopt. The next time you engage in self-stimulation, pause for a moment before you begin. Take a slow breath. Notice whether your pelvic floor feels lifted or tight. Many men do not realize they start in a state of tension. Applying a safe oil before stimulation can help you settle into a state of ease, which directly supports better firmness. As we move deeper into this conversation, it is important to highlight one ingredient that consistently appears in dermatology and urology research for supporting skin resilience: vitamin E. Many men have heard of vitamin E in the context of skin care, but few understand why it matters specifically for penile tissue, especially as they age. Here is what the research shows. Vitamin E is a fat-soluble antioxidant that helps protect cell membranes from oxidative stress. Oxidative stress is a major factor in aging, and it affects not just overall health, but the sensitivity and elasticity of the skin. Studies published through the National Institutes of Health have demonstrated that topical vitamin E can reduce inflammation, improve moisture retention, and support microcirculation in delicate tissues. These benefits become especially relevant for men over 50 when the skin tends to become thinner and more reactive. Let us break this down like I would with a patient. The skin of the penis is unique. It is thinner than most other skin on the body. It contains a dense network of nerve endings responsible for pleasure, and it is exposed to consistent mechanical stress throughout a man's lifetime. Over time, that combination makes it more vulnerable to dryness, micro-tearing, and irritation. When these issues develop even slightly, many men experience a drop in sensitivity or a shorter duration of firmness. Vitamin E-enriched oils support the skin in 3 meaningful ways. First, they improve elasticity. That means the tissue stretches and moves more comfortably during stimulation. Second, they reduce inflammation caused by friction or environmental irritants. Even mild inflammation can dull sensitivity, which makes arousal less responsive. Third, vitamin E supports the tiny capillaries that nourish the surface of the skin. When those capillaries function well, the tissue remains supple, warm, and receptive to stimulation. There is another important angle here. When the skin becomes irritated, the nerves beneath it become protective. They send signals to the brain that something is not fully comfortable. The brain responds by increasing sympathetic tone. Sympathetic tone tightens the pelvic floor, reduces erection quality, and shortens endurance. This is the same pattern we discussed earlier, and it is one of the main reasons men feel sudden drops in firmness without understanding the cause. A vitamin E-enriched oil helps interrupt that pattern. It nourishes the tissue so irritation is less likely to occur, supports smooth glide to reduce friction, and creates a calming effect on the nerve endings. This maintains the parasympathetic state that supports circulation and firmness. One study published in the Journal of Cosmetic Dermatology found that regular application of vitamin E significantly improved skin hydration and barrier function in sensitive areas. Another study from the Mayo Clinic noted that oxidative stress contributes to reduced tissue resilience in aging skin. By supporting antioxidant balance at the surface level, vitamin E helps maintain the comfort necessary for healthy sexual function. Here is one simple way to visualize this. Imagine your skin as a soft, flexible fabric. When the fabric is well moisturized and supported, it stretches easily and returns to its original shape. When the fabric becomes dry or slightly damaged, it becomes stiff, reactive, and more prone to tearing. Vitamin E is like the conditioner that restores softness and pliability to that fabric, making it easier to work with and far more comfortable during use. Before we wrap up this section, here is one practical tip you can implement today. If you choose to use an oil that contains vitamin E, apply only a small amount and allow it to warm in your fingertips before touching the skin. Warm oil spreads more evenly, reduces resistance more effectively, and allows the tissue to relax into the experience rather than brace against it. Now that we have explored how lubrication supports circulation, skin health, nerve sensitivity, and pelvic relaxation, it is time to bring everything together into a clear and practical routine. The goal is not complexity, the goal is consistency. Small, simple habits practiced regularly create meaningful changes in how your body responds. Here is what the research shows. Healthy erectile function relies on 4 major pillars working together: vascular flow, hormonal balance, pelvic floor relaxation, and sensory comfort. When one pillar weakens, the others work harder to compensate. When all 4 are supported, firmness becomes far more reliable. Using a clinically safe oil before masturbation is one of those small habits that strengthens the sensory and mechanical pillars, which then reduces unnecessary strain on the vascular and pelvic systems. Let us break this down like I would in the clinic. A nightly or every other night routine supports 2 important processes. First, it conditions the skin, improving elasticity and resilience. Second, it trains your nervous system to associate stimulation with relaxation rather than tension. Over time, this becomes automatic. Men often tell me that after a few weeks, they feel more comfortable, more responsive, and less prone to sudden drops in firmness. Here is a safe, step-by-step way to approach the routine. Begin by choosing a medical-grade mineral oil-based lubricant or a refined coconut oil. The skin of the penis is sensitive, and you want something that is inert, predictable, and free from fragrance or additives. Place a small amount on your fingertips, not directly onto the skin. Allow it to warm for a moment. This helps it spread smoothly and minimizes any initial shock to nerve endings. Apply the oil gently to the base of the penis first. This area contains the foundations of the erectile bodies and the muscles responsible for maintaining firmness. Supporting glide in this region helps the entire shaft respond more naturally, then move upward with slow, even strokes. The goal is to coat the skin lightly. You do not need a large amount. Too much oil can reduce sensation. A thin layer is enough to protect the tissue and enhance glide. Next, pay attention to how your body responds. If you feel the pelvic floor tighten, pause. That pause is not a failure, it is a moment of awareness. Take a slow breath, relax your abdomen, allow the pelvic floor to soften. This resets your nervous system into a parasympathetic, arousal, supportive state. This habit can also help identify early signs of irritation or dryness. If the skin starts to feel warm or reactive, that is a signal to adjust your technique. Add a small amount of oil or slow your rhythm. Over time, these small adjustments improve your relationship with your own body. You become more attuned to what enhances pleasure and what undermines it. There is one more important detail. The skin on the glands is incredibly sensitive and prone to irritation. Some men do well applying a small amount of oil directly to the glands. Others prefer to let the natural movement of the shaft distribute the oil passively. Neither method is better. The right method is the one that keeps the tissue comfortable and responsive without overwhelming sensation. By integrating this routine into your sexual health practices, you are not just improving comfort. You are supporting long-term tissue integrity, enhancing the conditions that allow stable erections and reducing avoidable stress on the vascular system. This is not a shortcut or a magic trick. It is evidence-based self-care for one of the most delicate and important parts of your body. Before we move on, here is one final practical suggestion. After stimulation, gently wipe away any excess oil with a soft, damp cloth. This keeps the skin clean, prevents buildup, and supports the natural pH of the area. It also allows you to check in with the tissue and ensure it feels comfortable afterward. Small moments of attention like this build confidence and awareness over time. As we bring this session to a close, I want to return to a truth that often gets lost in the noise of the internet. Sexual function is not a measure of worth. It is a reflection of physiology, and physiology can be supported, strengthened, and restored with the right information and the right habits. Here is what the research shows. The changes men experience with age are not signs of weakness. They are signs of tissue that has worked hard for many decades. The penile skin becomes thinner, the nerves become slightly more reactive, the pelvic floor becomes more protective, circulation becomes more sensitive to stress. These shifts are normal, they are common, and they are manageable. Throughout this session, we explored how a simple habit like applying a clinically safe oil before masturbation can support the conditions that make erections more stable and more comfortable. By reducing friction, you protect the epidermal barrier. By supporting elasticity, you reduce the risk of micro tears that can undermine sensitivity. By preventing irritation, you help maintain a calm parasympathetic state that supports strong and lasting firmness. You also learned how lubrication reduces unnecessary tension in the pelvic floor and helps the erectile bodies fill more consistently. You learned why refined oils and vitamin E-enriched oils can provide nourishment, hydration, and antioxidant support for aging tissue. And you learned how a thoughtful routine can help retrain your body to respond with ease rather than tension. These are small, practical, evidence-based strategies, not magic, not shortcuts, just physiology working with you instead of against you. If there is one idea I want you to take with you, it is this: your body communicates. And when you learn how to listen, you can respond in ways that protect your health, rebuild your confidence, and strengthen your relationship with your own sexuality. You deserve clarity, not fear. You deserve tools, not confusion. And you deserve a future where sexual health feels less like guesswork and more like self-understanding. If you found this session helpful, subscribe for grounded shame-free sexual health education from someone who works with men on these issues every single day. Stay curious, stay informed, and I will see you in the next